NSW. Doctors and nurses of Reddit. Despite knocking before entering a patient's room, what's the strangest thing you've walked in on a patient doing? 1. Parents freaking on their hospital bed while their 15-year-old child, the patient, is sleeping. 2. Child putting Play-Doh in the Jackson Pratt right after having a liver transplant. 3. Nurse kneeling in front of a teen patient, had the patient's back to me so I couldn't see what the nurse was doing, and the patient says yes, that feels good this way. Turns out she was only changing the bandage on his ankle. 4. As I opened my patient's door I can only see the doctor dancing on furniture. For the uninitiated like me, a Jackson Pratt drain, also called a JP drain, is a closed suction medical device that is commonly used as a post-operative drain for collecting bodily fluids from surgical sites. The device consists of an internal drain connected to a grenade-shaped bulb via plastic tubing. I walked in on 2 ladies getting it on. I apologized, told them I'd give them a few minutes to finish up, and come back later. I'll give you a few minutes to finish up. Stands in the corner. Go on. Working in neuropsych, the strangest thing I have walked in on was a fully cognitive 18-year-old male fricking his biological mother. The fricking was consensual and they both seemed to be enjoying themselves. However, needless to say, the mother was denied a private presence and given limited visiting hours after that. That mother sucker. I had a patient with dementia who constantly carried around a Bible. Apparently, I resembled her daughter and she would call me by her daughter's name. Every time I walked into her room she would scream at me for fricking that boy and hit me with her Bible. It was an interesting shift. That I know did PTSD time in VA psych ward, was the only female patient. Old grizzled veteran with wet brain was forever taking this woman's frillies from the unit's laundry. She would find him ambling down the passage wearing her skivvies or bra. He would grin, offer to return M. Nope. Then told her she reminded him of his daughter. Nope. I am a student midwife. One of the midwives I have worked with walked in on a couple fricking in a private room in an attempt to induce labor themselves before the doctors could get at them. They didn't even notice. It's okay. It's a medical procedure. Ellen Amp, D nurse, walked in on a laboring patient squatted over the floor trying to poop, right next to the bedside commode she had just been situated on. She said that it felt more natural. Phew, okay, yes, it is better to squat to do the deed. It was odd because she was squatting on the floor with nothing underneath to catch her impending bowel movement. I am constantly horrified by poop stories from nurses. The only thing more awkward than walking in on a patient using their central line to inject H is having to listen to them try to convince you that they were not just using their central line to inject H. I had very early in my medical career. Let's not forget that as awkward and embarrassing it was for me, the situation was surely worse for the patient. We are both human beings, doing our best to get through a hard day. Well, nurse, as you can see, this H appeared in the room and I am trying to get rid of it for the safety of this hospital. You would be very surprised at how much old person fricking is going on. Most of the time it's when a man is in the hospital and his wife comes to visit him. They just climb right into those beds and get freaky. God bless the frisky geriatric bastards. When hooked up to heart monitor they can freak out some nurses. 0. Paramedic, Germany, not full sanitor. We take our long words seriously. Last week, get a call to pick up an elderly lady from the hospital and drive her to another hospital to get her TEP, hip replacement, put in. We walk in, she's there with a young guy she introduces as her great nephew and who helps her put her stuff together. We tell her to pack up, go get paperwork started, and I go back for her to sign the transfer papers. Insurance, mostly. Knock, open. She's on the bed, playing with herself and sucking off the guy who's standing next to it on his tiptoes so he can reach her. He did a double take, told the guy that he could press the button to lower the bed so he didn't have to stand on his toes, and gave them a few more minutes. Knock, open. She's on the bed, playing with herself and sucking off the guy who's standing next to it on his tiptoes so he can reach her. He did a double take, told the guy that he could press the button to lower the bed so he didn't have to stand on his toes, and gave them a few more minutes. That's one dedicated cougar. This happened to another nurse, the married father of a 12-year-old patient, who just had open heart surgery and was heavily sedated, was hitting on a nurse I work with. At 10 PM he mentioned she looked stressed and offered to massage her. She declined and laughed it off. At 12 AM she went back in the room and he tried to massage her back without asking. She told him no in no uncertain terms and figured that was the end of it. At 4 AM she walked in and he was standing there naked and tried to seduce her. She called security, who then called his wife, explaining to her why she had to come pick her husband up at 4 AM in the morning and why he was no longer allowed in the hospital. Man gambled on 33% and lost hard. I walked in on a couple in the middle of a heavy Macchiato session, only to later find out that they were brother and sister. That was awkward. Oh, those Lannisters. During my first clinical rotation for nursing, a classmate of mine did an assessment on an older patient and came out saying she is absolutely a suicide risk. I'm getting her actual nurse. Turns out the patient's husband had passed away, and she was talking about how she missed him, along with saying things like, "I'm just tired of doing this. I just want to see him again. And life just seems pointless now." These are huge red flags for suicide risk. The classmate asked another classmate to go in and stay with the patient until the nurse could come in to check on her. When the other student walked in, the patient had a handful of her blood pressure meds. She dropped them on the ground and started crying. First time ever being nurses and we have a patient almost kill herself. Absolutely insane. Second day on the job and a patient in labor ward tried to kill herself due to postpartum psychosis via electrocution. I spent the entire night on suicide watch. She stuck her hand into the socket of a light bulb. Had to amputate most of her index finger. Her family wanted to take her out the next day for an exorcism. EMT had a call for protruding object, so my partner and I rushed to the patient's apartment. When Izzo opened the door, we saw him laying down with his butt sticking up and a blanket covering. There was something protruding from his shit chute. We peek under the blankets to see a thawed fish tail sticking out his butthole. Story was they tried riding back doors with a frozen fish and the fish thawed with the body heat and the scales got lodged in his shit chute cavity. Funny part was as my partner and I rolled him into the air, my partner hummed the theme song to Jaws. I lost my crap. I found a patient dead in her bed once, barely half an hour after I last saw her, being awake, well and confident she'd be discharged in a few days. Not me, but my mom is a nurse that works in intensive care. She told me about this one patient who wouldn't talk to anyone except for one of her co-workers, Debbie. So naturally Debbie was the one who always got this patient. When he spoke to her, he would be sincerely sweet and super nice, always trying to be a gentleman. Well, one day, Debbie wasn't there and my mom got to take care of the man. When she went to check on him, he was scribbling on a notepad, and as he noticed her, he tried to hide the notebook and accidentally dropped it on the floor. My mom picked it up and as she handed it back to him, she skimmed over what he had written. For days he had been scribbling and dark writing "frick Debbie" and "kill Debbie" and disturbing stories about him murdering her. He was transferred to the mental ward shortly after. That's the definition of a Debbie Downer. Girlfriend is a nurse, does not have a Reddit account, and wanted me to post this story. Here it goes. I had a patient that was a 60-year-old constipated woman, and she was in the hospital for a couple of days trying to get help for her constipation. We had tried everything from enemas to laxatives and nothing seemed to work. I went into her room to give her an update that we were going to call her doctor, and that's when it happened. She was laying on her side, with her butt facing the door, with her hand dug into her butthole digging out the crap with her fingers, like an ice cream scooper. I kind of just looked at her, not knowing what to do or say, but the look on her face was one of pure joy and satisfaction. Needless to say, she got it all out, and the entire bed was covered in her fecal matter. No corn though. I know this because I was the one who had to clean it up. TLDR, walked in on a human pooper scooper. I dated a nurse and she mentioned having to dig feces out of severely constipated patients and how satisfying it was when you succeeded and how frustrating it was when it retreated further up into the bowels, out of reach. We were eating ice cream at the time when she told me this and she just blabbered away about this as if she were just talking about the weather. I had a patient with hepatic encephalopathy. I walked into his room to give him a cup of water and he was drinking out of his urinal. Strange but understandable as the patient was very confused and quite old and on some good stuff. Walked in to pick up a tray. I'm food service, and the patient had his knife, just a butter knife, and was trying to saw out his catheter, but up higher than the exposed part of the catheter. I convinced him to give me the silverware before he could saw through his dong or at least lacerate it pretty good, and hit the call button and made sure nursing knew what was going on. Seen plenty of other strange things, as the floor I work on is the psych floor and another wing is oncology. They are often on some strong stuff, and also brain cancer makes you do odd things. This one just stuck out the most. Worked in a registration, collecting patient and insurance info when they wanted to be seen. Often, I'll visit the room twice, once to collect info and the second time to put the armband on the patient. I registered a female patient, and when I returned with the armband, I opened the door to see her boyfriend going to town on her down there. Female patient was wanting to be seen for her green tea discharge. I'll never forget that. I was about to perform a colonoscopy and the patient was shoving M&Ms in his rectum. Said he wanted to give me an Easter egg hunt. They were the larger peanut M&Ms, at least a small bag's worth. The nurses wouldn't eat them. Nurses had a peanut allergy. This can't be true. I admitted this elderly bedridden patient who had a daughter with him. She claimed she was his caregiver. I was about to find out how true that was. I'm at the desk when he goes into VFib. We bust in there with the cart, ready to save this dude's life. We throw the curtain back and this lady is jacking off her dad furiously while he lay in the bed, just having died. We coded him but to no avail. After the code, my charge asked what she was doing. Her response: whenever he gets worked up it's the only thing that calms him down. That was my first experience with not being able to even. Wasn't me, but a nurse I worked with walked in on a patient and her visitor doing the dirty. And by dirty, I mean dirty. Imagine the amount of gross crap that's gone down in an hour. Not to mention the woman wasn't not exactly ladylike. Turns out the patient was a H that would occasionally bring her johns to the to frick. She knew to say she had a lady problem so that she got a room with a door that's kind of in the corner. I guess if you need a room with a bed, the isn't a bad place. Although possibly the grossest setting possible. Needless to say, whenever she checks in now she no longer allowed to close the door. In a slightly related story, there was another guy who was so tall that he could stand up and see above the height of the curtain. He also happened to be a chronic masturbator. He'd either call the nurses into the room so they'd see him going to town on his dong, or he'd stand up and stare at all the nurses while he beat off. He's also not allowed to close the curtain anymore. I had a CNA certificate and worked as a third shift CNA in a dementia ward during college. I thought it would be a quiet job, but apparently that's when all the weird stuff happened. I had one patient that popped out his eyes. I knocked on his door just for the hourly wellness check and he didn't respond. Walked into his room and he was just sitting on the edge of his bed like he was waiting for me. I had to write the incident report after the nurse popped the eyes back in. He said a ghost told him to do it. An older lady with Alzheimer's that was giving oral to another resident. She apparently followed him all around the nursing home because he looked just like her husband. I felt so bad having to report this incident to the husband. It is required to notify kin when incident reports occur in my state, since he faithfully visited her twice a day, every day. As an IQ nurse, we get the super sick, which also sometimes means super crazy. Here are a few off the top of my head. 1. A gal who had a catheter in her femoral artery for vascular surgery standing beside her bed crapping on the floor. She was supposed to be laying completely flat in bed to prevent that cath from being pulled out. When we yelled at her to stop, she just looked us in the eyes and kept pooping. 2. This one wasn't me, but a friend. She had a patient selling drugs from her hospital bed. I guess a number of people just kept coming and going from her room at all hours, so they got suspicious and called security. 3. We had this paraplegic who would come see us every other month. He would unpack his white glove, and we would get the heck out of his room. We only walked in on him rubbing one out once, but that was enough. That glove still haunts my memories. 4. Had an alcohol withdrawal who was severely hallucinating and just wanted a cigarette. Higher level management caught me in there with her smoking. I gave her an unsharpened pencil and let her puff away. We got some strange looks, but she wasn't screaming and was pretty content, so I was happy. Not me, but a co-worker. According to her, a psych patient was picking scabs off his abdomen and eating them. All y'all are nasty. Not a doctor or nurse, but I worked in mental illness and treatment as a therapeutic specialist for years. The psychiatrist that ran the show for a set of physically shamed victims prescribed them corn cobs to handle their physical urges. This unit was for adolescents, usually around 14-16. I went to get one of the girls for activities time, and sure enough, she hadn't followed protocol for happy time by leaving a note taped to her window, and I walked in on her going to town on her corn cob. That was an interesting incident report to write. My wife is also in a similar position. It was shocking to me how often doctors prescribe corn cobs to patients. I mean, it's better than a mentally ill woman breaking herself on her toothbrush. It's still incredible that something like that exists in 2015. Worked as a tech at a local hospital. One night a woman came in via ambulance in full cardiac arrest. She died a little while later, after she passed. Myself and another tech were told to go make her presentable for the family. You know, remove the tubes, needles, straighten her sheets and gown. She was a larger woman, so we were bent over her going about our tasks. When she moved, not a little, a lot, as in she almost sat up. She was having post-mortem spasms. Think it's called Lazarus syndrome. Anyway, we freaked the frick out and ran screaming from the room. All the doctors and nurses nearly pee themselves laughing. Thankfully the family had not arrived. I work at an assisted living place. They are not really called patients there, they are called residents. Regardless, saw an 85-year-old guy jerking it to Pornhub while his wife was in the next room with the door open. She's basically 100% deaf, and I'm sure he's just making sure his prostate stays in check. Still kind of weird to see. I have a story from the patient's perspective. I was in the hospital with a tortuous appendix. Surgery went well and I was going to be allowed to leave after one night. The morning I was set to leave, I'm completely doubled over in pain, but they wanted to make sure I could walk before I was allowed to check out. I do so like a 110-year-old man and get the okay to leave. Well, being unable to hardly even move, I asked my mother to put my socks on for me, to which she proceeded to do. At this moment, a nurse walks into a slightly open door with my mom bent down and myself standing in front of her. The nurse exclaims, "Oh my gosh," to which was followed up with, "I'm his mother." It took the nurse a moment to realize I was not getting a blowy from my own mom, but instead was just getting helped with my socks and shoes. I was of course in severe pain and laughing brought on the worst of it, so my mom and I both had to do our best to forget about the situation and not speak of it until I could handle the pain of hysterical laughter. TLDR, nurse thought I was getting a blowjob from my mom. Responded to a very flamboyant AIDS-related dementia patient standing on the bed warding off his family by urinating and spinning arm circles while screeching like an eagle and flapping his arms. Bonus is he had inserted his heart monitor box into his anus and had the cord trailing out, which made him appear to have a tail with all 5 of the electrodes flying in various directions. He had also pulled his eye out during the spinning and had painted all 4 walls and his family with blood. As I am walking in, the patient's brother begins screaming at him to stop acting like some goddamn chicken bird and proceeds to tackle him, pinning him to the bed so that we can reset the crazy for the next hour. TLDR, male patient inserts square peg, telemetry box, into round hole, anus, stands on bed, rips out IV, and spins in circles screeching like a bird. When I had my baby, our nurse walked in our room rather abruptly, looking scattered. She said she just walked in another room where the dad had their newborn on his nipple as though he was nursing the baby. Apparently the mom was sleeping and the dad used what he knew to calm the baby down. My wife is a nurse and 2 stick out in my head. The first being a guy from a psych ward in for some kind of virus. Her and another nurse knocked and heard ready, so they went in. It was at this point that the patient says aim. They walk in to be met 10 featuring away from his brown eye pointing right at them. He was on his back with both legs pulled back and spread. Before they could respond, he yells fire and proceeds to projectile crap towards them. Luckily he must have misfired and only made it about 8 feet. They said nothing, left the room and bribed another nurse and tech to clean it up. Cost them a pizza for lunch. The second was walking into a delivery room when the mother-to-be, who happened to be 350 pounds and was explained to her friend how she had her mom and brother hold her legs so her husband could get her pregnant. Nurses need to be paid more. Yay. My wife had a patient tell her, a 550 pound pregnant lady, that she got pregnant by sitting on a table with a middle leaf removed. Her husband then somehow got below the table and went in that way. Worked with Alzheimer's points for years and worked mainly midnights the whole time. One night while watching Impractical Jokers I hear the one other aide scream for me in the other side of the building. I go see what's up and find her in an old man's room and the room was covered in blood like you killed a chicken and it ran around. Old man is pulling up his pants smiling while blood is pooling at his feet. I ask what happened and notice an inflated catheter in his garbage can. That's when I realized he ripped it out and told him to drop his pants. When he did you could see that the ball was a bit too big for his manhood to manage and it split like an overcooked hot dog and was bleeding all over the place. I had to hold it on together and call 911 while the 18-year-old co-worker screamed and threw up. It was a long night. Not a medical professional but I had a doctor tell us a story about them monitoring an expectant mother. She was hooked up to the normal heart rate monitor as well as the baby heart rate monitor. All of a sudden both heart rates spike very high. When they go to investigate they find the mother smoking crack in the hospital waiting to deliver her baby. That poor baby. It's usually knock knock open. I've never had a doctor actually wait so I can say hang on, just let me pull this tongue depressor out of my butt. A woman leaning over her mother-in-law siphoning liquid from her MIL's feeding tube. Long story short, she wanted her gone to get the house that was going to her and her husband after the woman passed. She thought a good way to hurry it up was to pull out the woman's nutrients and get her to die quicker. We still don't know how many times she had done that. She was a frequent visitor to the old lady's room. It was a rough day with police involvement. The patient was a sweet old lady who was passing away from old age and we had her there for over a month. One of my colleagues ended up sobbing her heart out in the break room. I walked out, called my mom and told her I wanted to change careers immediately, that I couldn't be around cruelty like that when my whole adult life had been dedicated to helping people. She talked me down but it took a long time for the anger and cynicism to go away. Different points. 1. Actively pulling out his rectum. 2. Pulling out his teeth, which he then threw at me. 3. Eating her crap menstrual blood. 4. Biting off parts of his tongue and spitting them at staff. 5. PT had barricaded himself in his room with blankets soaked in urine, vomit, ejaculate, and feces. 6. PTA was eating a plate filled of sugar and PTB's crap and blood. We were trying to reduce PTB's prolapsed rectum. Dang near killed him. Okay, this is the weirdest thing that I have seen a patient do. Gather around boys, it's backstory time. So I am a 5th year medical student in Egypt. One day I entered the classroom and there was someone teaching the cardiac symptoms in English and the whole time I was confused by his clothes and I thought to myself that the teacher looks like a homeless guy. Then suddenly he asks for a student to come closer with his stethoscope and the guy takes off his clothes and on his chest is a giant open heart suture and then I realize that he is actually a chronic patient who knows medical terms and symptoms of the cardiac diseases by heart. So TLDR is walked in a classroom and a patient was teaching the crap out of aortic stenosis and mechanical valve sounds. I realize that he is actually a chronic patient who knows medical terms and symptoms of the cardiac diseases by heart. You're freaking cold. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.